let's just say there is no, glaring problem going on. My relationship's good. All I want to do is make sure that I can continue to build really strong sexual well-being. And so if I do experience anything, well, where do I know where to go? Like, how do I know what to do? So that was one really positive thing that came out of it. And also people just really want to hear both personal insights of people who go through it or have gone through things themselves. And even more so, they want to hear professional insights. So,
welcome back to the podcast. I'm Tracy Donegan. Today I'm speaking with Grainne Byrne, the founder of Feel Norma, a brilliant new online resource for women experiencing challenges such as vaginismus, pelvic floor issues, menopause, painful sex, and more. In this episode, we discuss the need for holistic, intimate education and support for women around the world. And now I bring you Grainne Byrne.
Hi, everybody. You're very welcome to the next episode of my podcast. And today you're going to get to meet Grainne Byrne. And I might call her Norma throughout this interview, but Grainne has created an intimacy education program. And I'll let Grainne kind of take over in a minute. But this is such an important area for women's health. And it is such an area that has been really ignored. And I'm sure Grainne is going to join me in my lack of appreciation for research into women's health these days. I think it's in the spotlight at the moment, but we definitely need a lot more work in this area to support women's well-being. And it really hasn't been at the forefront of research for forever. So it's our time. So Grainne, thank you for joining me today. I'm really excited to hear about what you're doing and where you came up with the idea for Feeling Norma.
Thank you so much, Tracy, and thank you for bringing me on to your podcast as well. It's always such a good opportunity to talk about these issues. I'll never stop talking about them, and I will take you through a bit of my story and like the reason why I actually did create Norma. But briefly,
Please.
Norma is, as you said, an educational platform for intimacy education. So we have live workshops that are delivered by sex therapists, and also we have input from pelvic health physiotherapists as well on intimate issues from vaginismus, sexual pain. We also look at how ADHD impacts intimacy as well, and then also at specific life stages such as postpartum, menopause, and everything in between as well. But I suppose to give you a bit of background as to where it all came from, because I mean, I'm even in shock still that I'm in this area, and I never thought that my career would actually take me to this direction, because unlike yourself, I'm actually not a healthcare professional, and that's not my background. I was, I'd say, formally diagnosed with vaginismus, which for people who, if they don't know what it is a pelvic floor dysfunction, but there's also a psychosexual element to it as well. So for me anyway, that was, it was a lot of, let's say, an involuntary kind of tensing of my pelvic floor muscles when I tried to insert anything at all. So that also impacted, penetrative sex as well. And so not being able to do that with my partner at the time was quite difficult. And also there's quite a large kind of impact on mental health as well. So that was probably about 6 or 7 years ago. I was diagnosed with it, and I struggled a lot with trying to seek help for it. So as a lot of women do as well with their health issues, they look to others who are like them. And so I was online on Reddit forums trying to find out what is going on with me. Am I normal? That's where the kind of origin name came from. And I had tried to go to the GP, and I'm definitely someone who will go in and I'll look at the notes on my phone, and I'll be like, this is exactly what I'm experiencing. But every single time I went with this specific problem, and I was trying to get across, it's impacting intimacy, is impacting, I can't get let's say an STI test or a smear test. And I kept, it kept getting brushed off as normal. And I knew it wasn't normal. And I think I went to the GP probably, this was during when I was at university, I went probably about 8 times until the final GP, he said, okay, let's have a look. And basically did an external exam. Obviously I couldn't insert anything. And so then I was referred on to a gynecologist, and it kind of started from there. Even when I did get to the gynecologist didn't exactly have information that would be able to help me to alleviate it. I was kind of left alone with a set of dilators, which people will know, they're kind of like medicalized dildos that are graded by size. And if you can't even insert your finger, how are you going to go about inserting one of these plastic rigid things? And also at the same time, when I was in university, there was a researcher called Dr. Maria McAvoy, and she's one of the first people, I think, in Ireland in about 40 years to do a study on vaginismus and why it develops, how people seek help. And when I saw her flyer in one of the college buildings, I was like, oh my God, this is somebody who can help me, or who I can, she knows what I have. And so I wanted to take part in their study. And then I managed to, over like, let's say 3 years, with using different techniques, breathing techniques, also trying to use dilators. But it was quite a struggle to actually understand what I needed. But I actually came back around when I wanted to develop something to help women with sexual pain and with vaginismus. And that's when I connected with Maria again. And that was about 2 years ago now. And she's been also really good as an advisor and amazing support as well. So that's kind of the rough origin story of Norma.
So it took, did you say 8 visits, GP visits?
Yeah.
And then to finally get a referral to a gynecologist that had no understanding of the mind-body connection, really. So you're sent home with a set of dildos to...
Yeah, actually, it wasn't even sent home. Now I think they do, some healthcare systems do provide them for free, but I remember being told, and this is also, again, this is no fault of the medical professionals, because they don't get the training that they deserve around these psychosexual issues. So they're absolutely there's no blame on that part. But I think...
to a point.
To a point,
I think
absolutely.
To a point, medical professionals have an obligation to continue their professional development. And if you're working in obstetrics, it would, I would think, behoove you to learn more about vaginismus and women's experience of abdominal pain and
absolutely
penetrative sex.
Absolutely. And, even from any of the gynecologists that I work with and who advise me with the platform, I ask them all, like, to what extent did you receive education on psychosexual issues? And it actually, it comes down to them actually only receiving, let's say, maybe it's not even a full module in their, specialized master's degree on gynecology and obstetrics. And a lot of the people actually who do actually advise me, who are in that field, they themselves experience these problems, and they know there's a reason as to why. So there is that, element of they can see it in themselves, and it's wanting to create a solution that actually they would use themselves. So, at the end of the day, healthcare professionals are also humans that have problems as well.
Oh, yeah.
So that's important.
But so, and for you, did this started at a fairly early age? Because my understanding of vaginismus and its different causes, that it can be related to trauma, it can be related to a difficult birth, so there's physical and psychological components. So did you realize, I guess, at a young age that when you're starting to try and use tampons, that maybe there's something off here? Just for because I'm hoping that women that will watch this will share it with their teenage daughters, and just so we're getting this conversation started, younger and younger, so there's less shame.
Absolutely. Yeah, no, absolutely. So Tracy, I remember I was in an all-girls school. I was always baffled as to why people could use tampons. I thought, I tried so many times, especially probably when I got my first period around 12 or 13. And I think obviously because it wasn't, I didn't have to get an exam at the time, or there was no reason, for me to be able to even do that. You can use pads. There's other alternatives. And so, I remember that was definitely a thing that I noted, but I kind of probably put to the back of my mind until I entered, an intimate relationship, and with my partner at the time. I was probably about 19 or 20 years old. And then it became a real problem, because I was thinking, your mind oftentimes as well, when you have a condition that is psychosexual, you'll have a high degree of anxiety, and that can kind of come down to catastrophizing. And on one hand, you have, people learn from pornography, and they learn from the media that, penetrative sex is actually the main part of sex. Whereas, already that, especially if you're talking about orgasming, it's actually I think it's 2/3 of women actually orgasm primarily from the clitoris being stimulated, so
Sure.
not from penetration.
Mm-hmm.
And so then we're looking at kind of sex, and we're looking at it in terms of a mentality of, who is this for, whose benefit is this for, and how are both people enjoying this, and we're talking in that perspective from like a heteronormative relationship, right?
Sure.
So yeah, I think I had always known that there was something off, and I think it could have been, let's say, intercepted at a lot earlier stage had I
Mm.
had the education around it. Because obviously, as you know, a lot of our sex education worldwide is really focused on prevention. So, I mean, STIs and preventing STIs is extremely important, of course. It's just that when it's so fear-based,
Mm-hmm.
that's why a lot, like, and also performance focused, it's detrimental really to young people. And
Totally.
I was one of those people.
So tell me, is there interest from the schools? Because I think this would be really important part of the curriculum for sex ed.
I actually haven't spoken with schools yet, Tracy, but what I do get is a lot of parents. And when I'm on, especially a lot of our forums and in our community, sometimes it's actually the mothers of adolescent girls that actually are experiencing this, and they're
Mm,
actively looking for solutions, perhaps they can give to their, or resources that they can give to their daughters, so
sure.
that they can help themselves, and especially tap into that kind of rewiring that mind body connection,
Mm-hmm.
especially because nowadays as well, it's so like vaginismus, as I said, is really highly correlated with high anxiety. I mean, post pandemic as well, we have all of these things, a lot of a lot of stresses in life, and then, as you know as well, we have like we're holding a lot of our tension in our body, in our pelvic bowl and in our pelvic floor, and we can be also having it here in our jaw as well. So we're holding it that way, and it is about retraining those muscles again. So as I said, it would be brilliant if we could feature something within schools, and have it as an let's say, early educational intervention that everybody
Yeah.
deserves.
Yeah. I think it would be phenomenal again to look at what's happening out there in, women and young girls' lives and, preempting, because as you know, when you're working with this kind of condition, it has such an impact on your self-esteem, your mental health, and it'll just have a knock-on effect, throughout the rest of your life, unless if we can. And one thing I actually love about your program is the focus on mindfulness, which of course I'm a huge fan of, and self-compassion, and that whole mind-body connection, which I think really has, especially post-pandemic now, to be
Mm-hmm.
able to have some tools to reduce that, that level of anxiety that is unfortunately global at the
Yeah.
moment.
And Tracy, even to that point as well, so with women that experience vaginismus, and painful sex as well, a lot of the time when I speak with them, I actually hear, sometimes it's quite difficult actually to speak with them from my perspective. So internally, I'm hearing the same things that I would have said to myself years ago. So that can jump to,
Mm.
from things, and I'll let you know, like, how I was thinking when I was having this was, well, who's ever going to want me? Um, and also, oh, and also as well, sorry, I just dropped out. So who's ever going to want me? How am I ever going to have children? And so your mind goes to these, this kind of type of catastrophizing, which it's very difficult to break out of that cycle once you're in it.
Hey there, if you're enjoying this conversation and are passionate about evidence based care in labour, the best way to support our work is to subscribe and share this episode with other amazing women in your life. Your support is so important to us and helps us reach more mothers with empowering content. So go ahead, hit that subscribe button and spread the love.
So I think, to my own experience and my own story of how it could have really helped me so much to understand what was going on, and understand that, these types of things can happen. It's not just only about, using protection if you to prevent STIs and other infections, and also, around pregnancy and planning about that. There could have been so much more about, even it could have even be focused on, relationships and entering that period of your life as well. So I definitely think it would be so helpful. Parents are looking for these resources. It's quite difficult to navigate these conversations as well with teenagers and adolescents. So I definitely think education intervention from a young age is brilliant, and it's so recommended.
Yeah, and I think we're kind of back to the conversation of normalizing sexuality and normalizing the fact that, again, porn is not real, but unfortunately, huge numbers of teenage boys that have very different ideas of what they're expecting in a sexual encounter, which someone else needs to develop another program on that for that completely as well and bring it into our schools. But I want to ask you about, you mentioned these live workshops, okay? So I lived in California for a couple of years, and there, San Francisco especially, would have lots of workshops on intimacy, and some of the reports that I was hearing from the workshops were that everyone was, taking off their clothes and exploring their own genitals and other people's genitals. And so I imagine there's some viewer thinking, what happens at these workshops? And is it something I really want to take part in? So please reassure us what's going on at these workshops.
Absolutely. So that is one big thing. Even so, the people who are delivering the live workshops are accredited, fully qualified, registered sex therapists, sex and relationship therapists as well. So this is a specialized form of talk therapy, and it is to talk around and explore any issues, anxieties, that people are facing that's related to sex and a relationship. So these type of professionals don't touch anybody whatsoever. And, it's very, very different world from what you've been talking about, in terms of live workshops. Perhaps I think you're probably talking about ones that have Tantra yoga influence. And that kind of area.
This is focused on women's sexuality, and I appreciate that these workshops, specifically some of them were actually very helpful for women, because
yes.
As there's so much shame that girls grow up with around our body, and so a lot of these women had actually, and unfortunately I've had this experience myself as a midwife. That I come across women who have never seen their own genitalia.
Yeah. Mm-hmm. Yeah, absolutely.
And that is shocking to me, that we're in this day and age, given that, there's, we've got, models, selling sports cars, and it's so in your face all of the time that we're so disconnected below the neck, really, to our body.
Absolutely. So I completely with you on that, Tracy. So even one of the first tasks that a sex therapist actually might suggest to a woman that has vaginismus, for example, or in general as well, is to actually, if they feel comfortable, to take a mirror and actually look at their vulva and look at the different parts and look at it in a non-sexual way as well. And back to the workshops as well on that point. So the ones that we actually provide, they're providing you with the necessary education, tools, tips, exercises that you can do, and also those professional insights behind them as well. So oftentimes you want to hear those things that, people go to sex therapists every day. They see hundreds of people every year. And what are the problems that they're seeing, and what are the different kind of presentations? And one so important thing is that to have these type of professionals deliver this workshop, it means it's trauma informed as well. So, and with those other types of workshops, I think they can bring an amazing spotlight on these issues. But I always just recommend checking credentials of people who are running them. Just because, people can kind of, it needs to be inclusive, and it needs to be trauma informed. And everybody needs to feel as though they're welcome at them. And nothing that will be suggested is something that is inappropriate for them to do, or they feel under pressure. So in our workshop, you have your camera off, you have your mic off. There's no need for this. But you are absolutely free to use the chat to ask any questions. There's also reflective tasks. So a lot of the time in our workshops, we'll have especially mindfulness kind of interventions, as well as a pen and paper where you can actually just explore what you're thinking about a specific thing. So even within our vaginismus and sexual pain workshop that happened on Monday, We had people exploring their cycle of fear and cycle of pain. So like, why is it actually happening? What are the things that not just started it, but continue it? So I mentioned even to you there, we thoughts around, for me, that continued vaginismus were, well, who's ever going to want me? You know, and who's ever, you know, these kind of things, which are really terrible to think back that I had actually thought that about myself. But that was what was keeping a lot of the fear going as well. So that's one exercise. Other fun exercises as well, that can really bring a lot of more compassion and positivity as well back into your sexual well-being. So those are just a bit about our workshops, and how they might be different from other ones that happen in real life like that.
Just a quick one for you. So if I was a part of the vaginismus workshop, so there could be another group of women on this, but it's cameras off and you can have your mic on or off. So how are you checking for that anyone who's coming to this workshop really should be at that workshop, and it's not some stranger that wants to, you know, listen in to women's sexual challenges?
Yeah, no, I think we have with all of our materials that are, you know, talking about the course as well. We make sure to try and catch the people who really, really do need this information. And so, coming from a background, I know that there are so many reasons as to why painful sex might be happening. And, you know, vaginismus and painful sex are related. But specifically for this workshop, it's for people that have, you know, a bit more anxiety around penetration and anxiety around insertion of that kind. Perhaps they need to use dilators and they don't know how to. So it's targeting those types of people. You'll also have people then on the other side of the spectrum that perhaps maybe it's due to, you know, your hormonal changes after postpartum. So you're basically breastfeeding and your estrogen is low. Perhaps you're perimenopausal, and because of that dryness in those situations, or perhaps just because of even the birth control pill, which can cause dryness as well, you might be experiencing pain during intimacy. And that's not specifically vaginismus. That is actually hormonally, you know, driven. Sure. So those types of people, it's earmarked that, you know, specifically for vaginismus and sexual pain, this workshop is for people who have a lot of anxiety around it and a lot of, you know, negative thoughts, and we want to equip them really with that right information. But we don't have a problem with with people who are trying to attend and just trying to listen into problems. In fact, if people can learn a lot more about these problems, it's probably a good thing. So
yeah, oh no, I've no problem with, you know, someone who's kind of trying to educate themselves. But if I'm just wondering if, you know, if someone has already experienced so much shame and low self-esteem, and to come onto a Zoom, and then I realize, well, actually, I don't know if the other participants have been screened. I don't know if there's a random dude sitting listening to this as well. So that would be a concern that I'm sure other women would wonder, is there a way that you're screening? Because during the Zoom, we had all these strange episodes with Zoom and people just randomly, you know, being able to gate crash a Zoom. And but as you're doing with cameras off, I think, I'm just trying to figure out how we're making sure this is a safe space for women.
Absolutely. No, it's 100% like an absolutely normal concern to have. And what we actually find is that sometimes people will ask as well, is it okay if my partner sits in the background, or if it's okay if they actually listen to a recording? Sure. Because what the impact can have on the partner can be significant as well, because they might have feelings around, oh, is this because of me? So I generally think that it is the, you know, and some people choose also not to comment or not to, you know, chat until the Q&A at the end. But I definitely think with the screening bit, people, and I'm coming from somebody who has had vaginismus, is that the people who are arriving at the workshop, they've done so much research already around what they have and around that, and you know, they know that they need, you know, to actually talk to an intimate health expert such as a sex therapist. So people arrive to themselves, and it is, you know, you have that screening measure as well. But yeah, I think that it's really people gravitating towards information that they are in dire need of a lot of the time.
Yeah. And what's the feedback been from the workshop so far?
Really good, really positive, Tracy. So we had one of our pilot workshops in December, and that's why the engagement and attendance levels really kind of blew us out of the water. We were really pleasantly surprised, and we basically kind of, in terms of the feedback, what people actually just said were, can we have more of these on different types of issues, and also as well on general sexual well-being. So let's just say there is no glaring problem going on. My relationship's good. All I want to do is make sure that I can continue to build really strong sexual well-being. And so if I do experience anything, well, where do I know where to go? Like, how do I know what to do? So that was one
Yeah.
really positive thing that came out of it. And also people just really want to hear both personal insights of people who go through it or have gone through things themselves. And even more so, they want to hear professional insights. So like even hearing a story of, someone who has gone through something like you. So even, I'll know from my own friends as well who have just had babies, and even kind of talking a lot more about it. If they can feel heard, then
Oh,
it makes a big, big difference.
it is. And it's, as someone who's engaged in this area of maternity services kind of on a regular basis in Ireland, feeling heard, it's such a simple thing, but it seems to be so difficult for so many providers. And I absolutely understand that, the system is quite fractured and that the providers themselves are working within, very, very difficult constraints, but it's an ongoing pattern that we have. And I just mentioned this study before we came on, and I'll send it over to you because it's such a powerful accounts of women's experience trying to get health care and trying to get help for abdominal pain. And a number of these women were experiencing painful periods, endometriosis, PCOS, or unexplained. And it's the paper was by Eileen Windrum. I think she's actually out in Galway. But as a qualitative piece of research, like, again, the themes, I hear it so often in maternity services as well. But these women were, again, going to their GPs, then being referred on to gynecologists and feeling dismissed. And like some of the reports, women were saying, I bawled my eyes out in the car afterwards. I had to beg to be given anything because of the pain they were in. And even what I thought was quite interesting, some of the women who mentioned like they actually got a harder time from female providers who basically said, welcome to womanhood, and completely dismissed them. So I don't know if you're familiar with the MAMI study that came out of Trinity College. Yeah. And again, like women going to postpartum visits with their GP, and they're not being asked about sexual functioning or leakage or anything like that. And women felt like, oh, so maybe it's just me, or maybe this is part of being a woman. I just have to get on with it, And I think it's so important that we really curtail that message to women that you matter, your experience in life matters, your healthcare, your sexual satisfaction matters. And I think that's a really important conversation to be continuing in Ireland, that again, I think our Catholic, upbringing for many of us, that those feelings around your body and about sexuality was it's repressed, really. So the fact that we can even have a conversation about, even if you don't have any issues, that there's ways that you can, maintain a really healthy, sex life. There are things you can do to improve it. And I think these are just great conversations that we have to be having with women of all ages, so it's not just, the 20 something, it's the woman in her 70s who is still, sexually active and wants to talk to other women who are, have, great experiences and share their experiences, because we have this, long life of, and we can really make it so much more enjoyable for women if we can kind of, let's disperse the shame a little bit and keep these conversations going. But
Absolutely.
I wanted to just quickly ask you a little bit about ADHD. So you had mentioned that I'd seen that and this was something that was news to me. Would you tell me a little bit about how that can impact sexual functioning and
Yeah,
sexual health.
absolutely. Absolutely. So I'm sure you've seen there has been definitely a trend on social media, online, of people who are, thinking, okay, do I have ADHD, or is this something that's, like there's a lot of a spike basically in people who are going to search for a diagnosis as well. As you know, ADHD is a neurodevelopmental condition, so you can develop it over time. And all previous kind of studies around it were really looking at young boys and males, and the representation of what ADHD was in them. So a lot of the time that would be that the hyperactivity. So we all know, like, when we think about ADHD, we think of a young boy who is like running around a classroom causing havoc. Which is not at all, it's not the typical really case of ADHD. And I have a wonderful advisor called Dr. Natasha Langan, and she had been in the NHS psychosexual department for years. She's a clinical psychologist and a sex therapist, and she currently works in Ireland in the public sector, and she is working in an adult ADHD clinic. And we were having conversations about ADHD and its impact on relationships and on sex as well. And so what people like, let's say, we'll see from a lot of symptoms that people with ADHD have, it can be around a distracted element. There's also as well, people can associate or assume that because there's this hyperactivity, there's also a hypersexuality. And that's not necessarily always the case as well. It can actually flip flop. So like with low sexual desire. So they're just some of the things that people do experience. But we do understand that, like, there is a spike kind of in searches around for, my partner has ADHD. Lots of people with ADHD, they might relate to that hyperfocus or hyperfixation where they could go for hours without eating a meal. And so because there's so many different types of presentations, that can impact on another partner in a relationship, for example. Also distracted, being distracted as well in the bedroom, outside the bedroom, doesn't matter what it is. How do you manage that? How do you navigate intimacy with that experience as well? So that would be around how our workshop would work, with Dr. Natasha delivering it as well, on ADHD and intimacy in relationships.
I'd imagine as well, and this is purely my own perspective, that the digital age and social media has really, curtailed our focus, and I would say is likely to be a contributing factor, because we're constantly distracted, and the dopamine then hit that we get every time, we get a like, or, it's really keeping us on our phones rather than out in real life. And I think our attention span has just gotten, narrower and narrower. So I think the aspect of that is part of your program, the mindfulness, is like learning how to regulate our attention, and because where our attention goes, energy flows. And so it's such an important part of it.
Tracy, actually, to add to that, what's so interesting, so when I was initially speaking with Natasha around ADHD and also anxiety levels, so we know people who have ADHD often they struggle with anxiety as well. So, and on the other side, we're seeing as well vaginismus and people who are struggling with anxiety. So we actually kind of saw quite an overlap. So when I did initially qualitative research, because my professional background is in market research, and starting out on all this, I interviewed about 25 women from age like 20 to 35 or so, and many of whom suffered from sexual pain. So not just vaginismus, but painful sex. And I also saw this, and a lot of the time they actually also disclosed that they also had been diagnosed officially with ADHD and or autism. So that's not in all the cases whatsoever. Like, I'm someone who had vaginismus, and I've not been diagnosed with any of these neurodivergent spectrum disorders. But it is really important to understand how those things can coexist. Do you get me? And can influence one another. But along with technology, I 100% agree with you, especially with our attention span. And no doubt that has an impact on how we're moving through the world.
Yeah. constantly distracted state, and what's next? It's what are we doing next? This has been so helpful, and I'm sure it'll be really helpful for lots of women around the world who will be listening in. When we spoke last week, I was mentioning to you about the red light therapy and this wand. So I wanted to kind of show you in action.
So cool.
It has a vibratory function as well, but it's red light therapy and blue light. So the red light brings blood flow to the area. So, and there has been some research on red light therapy for endometriosis, and just again, menopause, women who need a little bit of extra help. And so I think, we've got tools that we can start using, but I think the top tool we have to start using properly.
Exactly. And that's what I always say, Tracy, as well, is I set out to try and create a solution for women who have vaginismus. I was thinking about creating a dilator kit or something that could be better for a woman like that to use. And then I navigated that way, and I said, no, there actually needs to be some form of a psychoeducational intervention. So I definitely think there's to have a focus on that. And it doesn't matter exactly, it can be something physical that triggers it. It could be that you are postpartum, but there always is, it's a psychological element to any type of pain or illness or anything like that. And especially if it does impact your intimate life and perhaps, your sexual well-being as well. But I actually wanted to come back to it as well, because I really wanted to say that I was so happy to see that MAMI study, MAMMI one, and the fact that it was actually an Irish study. And I always quote this study all of the time, because the research in it is just, it's so clear. And the fact that there has been a study that has looked at sexual well-being in women who are postpartum. So it was all first-time mothers that they had been following. And the fact that they addressed, had they been asked by either their public health nurse or by their GP, I believe it was about 87% of whom were not asked about their sexual well-being at the 6 months or the 6 week postpartum appointment. And also, which is when people are expected to, potentially resume sexual intercourse, which is not in reality. I don't believe it's something that is applied to the majority of people. And also as well, there was a stat from that, which I really think it just illustrates so well about sexual pain. I think before these women even got pregnant, I think it was about 20% of them experienced dyspareunia, which is painful sex. And at 6 months postpartum, it raised to 30%. So that just shows you as well, those things are not talked about. If women are going around without that information about, breastfeeding impacts, how I'm going to approach intimacy now. How do I deal with, maybe my partner has needs and I can't fulfill them at that moment, or what are my needs and how do I want to be touched? So those conversations are so important, which is why we also have our workshop around postpartum sexual well-being. But I do think the more research that comes out, I'm so happy to see, around all different types. It could be also as well women who are going through cancer treatments, or women who have diabetes, or across the board. Because any type of illness does impact, and any type of condition can impact your sexual well-being.
And another area that tends to be just disregarded in Irish society is women that are living with disabilities.
Yes.
And their sexual satisfaction as well. They're almost an unseen part of womanhood in Ireland. But I think we're starting to see some changes there, and seeing more kind of recognition that we have, if we're going to be inclusive, we need to be inclusive of everybody. But thanks for bringing up the MAMI study again. It's such a really, really important study. And it is interesting, over the years, in my work, I've worked with some expectant moms with vaginismus, and so we've had to, talk about birth preferences around internal examinations, because the fact the baby is coming out is actually less stressful than someone actually, doing repeated vaginal examinations, which we know are not evidence-based anyway. And unless they're going to change the plan of care, really, we don't need any more fingers in there during labor. It's stressful enough. And just to your point around anxiety and pain, it's something it's part of, childbirth education these days, that the more stressed you are, the higher your pain levels are going to be. So if,
Yes.
we can't always control, an injury or something that we've had, but how we relate to that
Hmm.
injury or that complication can really change the pain perception significantly. So it's not a case of
Yeah.
just relax, because if anyone says that to you and you're dealing with vaginismus, the response you get is not going to be very positive.
Yeah. Exactly.
Or the postpartum advice, oh, have a glass of wine, and I'm like,
I've been told
yeah,
this person, I was told that as well by a medical professional. Have you tried, having a glass of
getting
wine?
drunk.
And actually, even to that point, like I remember speaking with a couple of different women during that round of qualitative research, and some of them actually said that they can't have penetration or penetrative sex without using cannabis, or like as in smoking, or drinking
Mm,
beforehand. And that's not, like, that should never have been even a thought in their mind to have to do, in order to become relaxed.
yeah,
So that there is other parts where if a medical professional is saying that to you, report them.
yeah, please do. Um, Grainne, thanks a million for joining me today. This has just been really, really fascinating, and I'm sure we'll have lots of questions, and I'll include all of your details. Tell us where people can find you on social media.
Yeah, for sure. So thank you so much, Tracy. So you'll be able to find Norma it's basically, the username is Feel Normal, but minus the L. So Feel Norma. And then the website is the exact same. So it's www.feelnorma.com. And then if you'd also like to follow myself, my full name is Grainne Byrne, but my Instagram handle is at Grainne Byrne, for very obvious reasons.
Great. I'll include all of that detail for everybody. Thanks again. This has been really, really insightful, and I'm sure it'll be helpful for a lot of women. And it's a conversation that we definitely need to continue.
Thanks,
Thanks, Grainne.
Tracy.
Thank you so much for tuning into today's episode. Remember, empowerment begins with knowledge. If you enjoyed our time together and want more content like this, don't forget to like, subscribe, and share with your friends. So stay inspired, stay informed, and until next time, take care of yourself.